Oh, hello there, my lovely. You make yourself comfortable. My name's Dr. Sarah. Pleased to meet you. So what can I do for you today? Okay. So you're feeling a little bit dizzy and your ears are hurting. All right. Any other symptoms? Any cough? Blocked nose? No? Okay, how long have you felt like this? Okay. All right. Okay, so you've not had any cold or allergies that you're aware of? No? Okay. Any problems with your ears in the past? So you do get wax problems, okay. And is your dizziness affecting you when you're standing, sitting, lying down? Right, okay. Is it all the time or just intermittent? All right. Do you have a feeling of fullness in your ears? Okay. And have you been doing any swimming recently? All right. Do you put Q-tips down your ears? Okay. All right. Well, that's not a wise idea. It may be that you've pushed some earwax deep down, but we'll have a look at that. Okay. Yeah. Okay. All right then, my lovely. Well, first things first, I'll do a little check of your temperature just to make sure that there isn't any infection going on there. All right. So I'm just going to pop this inside your ear. All right. There we go. Just hear a beep or two. That's fine. There's no infection there. Right, let's have a little feel of your lymph nodes. I'm just going to pop some gloves on now. The temperature, it was 37, so that's absolutely normal. Nothing to worry about there. Okay, so just look straight ahead for me. I'm just going to have a little feel of the lymph nodes around your neck, under your jaw, and just at the back of your head, alright? Okay. Okay, just round the back. Okay. Alright, that seems fine. Okay, I'm just going to check just inside your elbow. There's a lymph node there that's quite hard to find, but I'll just want to check it. Okay, if I can. Just relax your arm for me. Okay, there's no worries there. Alright. Do you mind if I take a little look inside your throat? Okay. I know, it's not the nicest thing, is it? Okay. Right. Open nice and wide for me, my lovely. Okay, there we go. Just going to shine this light in. Okay. Say R for me. Okay. That's lovely. And while I'm at it, I'll have a little look in your eyes. Okay. Just look straight ahead for me for this. Okay. Just coming in there. Just checking with you, saying you're being dizzy, that's all. That I can't see anything unusual going on. Okay, that's fine. Right, I'm going to check your blood pressure, because in some people changes in blood pressure can cause dizziness. So I'd just like to rule that out first. I'm just going to pop my stethoscope in. Okay. So I'm just going to pop this cuff around your arm and inflate it, alright? It will go tight, but not for long. Okay? Let's get that on there. Just relax your arm for me, my lovely. Thank you. Right. Perfect. Right, just going to pop my stethoscope under there so I can hear the artery. There we go. And just going to inflate that now, okay? Just stay nice and relaxed. That's fine. No worries there at all. Okay. There we go. Let's get rid of that. Okay. Just going to pop the stethoscope onto your neck a second. Just breathe normally for me. Just a little quick listen to your chest. Deep breath in for me. And again. Again. And again. That's fine. I was just listening to see if there's any crackles or whistles or anything strange going on, but absolutely nothing. So I don't think there's any infection at the moment that I can see. Alright. So what I'm going to do next is have a look around the ear and inside your ear, okay? Right, let me just give the ears a nice wipe first. Just got a nice gentle wipe, okay. Just around the outside to remove any debris. We don't want any of that going down your ears. Just little bits of dust and things that we pick up along the way during our day. Okay. You doing alright there? Perfect. Right, let me have a look at your right ear. Okay, perfect. So, now I'm going to use the otoscope. See, it has a light on it, and this speculum goes inside your ear canal and lets me have a little look around in there and see what I can visualise. I'd like to be able to visualise the eardrum and the structures behind it, but if there's a wax impaction, the chances are I won't be able to see that. Alright, so I need you to keep very still for me. Pop up your hand if you're not comfortable, but please don't move, alright? Okay. So I'll just be pulling up and back very, very gently, alright? Very gently. Here we go. And going to insert that now. Here we go. Alright. There's some wax down there for sure, and it looks quite firm, so I'm guessing that's what's causing the ear pressure and a little bit of dizziness there. It's pushing against your eardrum. Is that a little bit sore? Okay. Ear canal looks a little bit irritated too. You okay there? You're not dizzy? Good. Try and keep that head still for me. We're doing really well. I don't want to make you dizzy, I want to make you feel better. Okay, so I'm just going to pull up and back again, my lovely, and insert this again now. Okay. Right, let's take a look here. Definitely some hardened wax on this side as well. Looks very impacted. Looks a little red. Is that a little bit tender too? Yeah, okay. Okay, I'll remove that now. Okay. You alright there? Good. I'll just update this a little. Okay. So what I'm seeing in both ears is an impaction of wax. Okay, this side looks like it's a little bit more blocked. Are you getting more pain on this side? Okay. So there are various ways we can remove earwax, and I know you've probably had some things done before if you've suffered with earwax problems, yeah? So my first line of attack is to use some really nice fizzy drops, okay? My patients usually love these, so I'll just put a few down each ear, and then you'll hear a fizzy crackly sort of sound, alright? And that will be the sound of the drops breaking down that hard wax, so it makes it easier for me to remove it, okay? You can buy similar things from the pharmacy, but these are stronger, okay? But they won't sting or burn, right? So, just give them a little mix up. Okay, right. I'll pop some in your right ear first, okay? feel quite cool going in. So here's 1, 2, 3, 4. I'm going to put 4 in that side because it looks a little bit worse than the other one. Okay, give that a little rub. And then to pop a few in this side. Here we go. Here's 1, 2, and 3. And a little massage. Okay, so you'll be fizzing nicely now. Let's just get a few things ready. Okay. So I'm going to use this long-handled spoon-shaped tool here just to gently go in and scrape away at the wax, okay? Again, keep very still for me, my lovely. I know you're very good at that. And just pop up the hand, okay, if anything hurts. All right, thank you. So let me just get some tissue there. Right, here we go. Nice and still for me, thank you. That's coming away nicely. Excellent. Well, there's a lot come out of there just. Yeah, huge hard lumps, so I think that's cleared the worst of it. So we'll have a little look on this side now, see what we can get out. Yeah, nice and still. You're doing all right there? You're not dizzy or anything? Good, good. So now what I'm going to do is use my special little brush, and that will help to remove any loose particles that are down the ear, okay? Yeah? Perfect. Again, just pop up the hand if you're not comfortable, alright? Okay. Here we go, my lovely. Might sound a little bit loud, but it shouldn't hurt. You enjoyed that? Good. Okay, going in on your left side now, lovely. Wonderful. You're feeling good? Perfect. So now I'm just going to give your ears a little puff of air with this, okay? Just to remove anything from the outside. Okay. Gentle little puffs. Brush in. That tickled? Good. Okay. Going to have another look with my otoscope now. Just to make sure that it's all clear. You feeling better? The pressure's gone. Perfect. Just going to pull up and back and pop this in now. Okay. I can see your eardrum now. That's looking actually very healthy, which is good. Slight bit of redness in the ear canals, but that would be expected. your left ear, and then you'll be pleased to know that we're all done. Okay. That's looking so much better. Eardrum looking fine, intact, no wrinkles bulging. Can see all the structures behind, slightly reddened ear canal again, but that's okay for now. Okay, perfect. Okay, so I'm going to pop some more drops down your ears now before you go. This will just help soothe them. Okay, because I have been doing some very deep cleaning there. All right. Okay. These feel very cool and lovely. If you have any problems, just give us a call. If you start feeling feverish or more dizzy or unwell, or there's any strange discharge from your ears, please just call us, but I think you'll be fine. Okay. Right. Just pop that in there. There's one and two. Just give that a little while. There we go. Yes, they do feel nice. Okay, here's one and two. Okay, my lovely. Well, you're free to go. All right. I'll update your notes after you've left, and I hope you have a pleasant day. Yeah, you should feel much better by the end of the day. Yeah, your ears might feel a little bit irritated for a day or so, but those drops will help. Yeah, all right. Okay. Take care now. Bye-bye. Oh, hello there, my lovely. Take a seat, make yourself comfortable. My name's Dr. Sarah, pleased to meet you. I was just checking through your referral sheets here, and you're here for me to do a general checkup on you today for your employment. Is that right? Okay, that's perfect. We do a lot of these things. So I have a checklist from your employer of the things that they'd like me to check with you, make sure that everything is good. So firstly, I just want to check, have you had any recent infections, or are you feeling unwell at the moment? Okay, that's fine. Okay. And any recent surgeries at all? Okay, fine. And have you been travelling anywhere abroad? Okay, where did you go? Alright, that's fine. So nowhere where you'd need vaccinations or at risk of disease, that's okay. Okay. Right then. So do you have an allergy to latex at all? Okay, that's fine. Let me just grab some gloves. And we'll take a look at you. Could you just confirm your current telephone number, please, for me? I want to make sure that the notes are up to date there. Okay, that's perfect. Right then, okay. So first of all, I'll have a little feel of your lymph nodes around your neck, alright? Just to make sure there's nothing lumpy, bumpy, or feeling sore or tender for you, okay? Just let me know if anything's uncomfortable. Just go around the back here to check the occipital area. Okay, that all feels fine. Right, have you had any ear problems at all? Okay, right, okay. So what I'm going to do, I'm going to check your ears. I'll give them a little wipe around on the outside first. We'll have a little press around and then look in the inside of the ears, okay? I'll just give your right ear a wipe first. Okay, good. Okay, do the same on your left side. Okay. So while I'm here, I'm just going to have a press around the outer ear, okay? Tell me if anything's uncomfortable, my lovely, alright? Okay, good, I couldn't feel anything unusual there, alright? And on this side. Okay, perfect. Just make a little note there. Okay, so that's all good. Okay. Right. So I'll take your temperature and then I'll have a little look down your ears, okay? This thermometer just goes inside your ear and you'll hear some beeps, alright? Any preference? This side? Okay. Pop it in here. Here we go. Temperature's perfectly fine. Okay. Wonderful. So I'm going to just put a new tip on there. So I'm going to use the otoscope, and the otoscope has a light on it, and the light just lets me have a look down your ear once I put this inside the ear canal, okay? Keep your head very still, alright? Try not to move at all. Pop up your hand if anything's uncomfortable just while I have a little look. Okay, alright. So, here we go, just popping it in now, my lovely. Okay. Oh, that's a very healthy ear canal. Okay. just repositioning it there. Yeah, that's all good. You can see the tympanic membrane, your eardrum, and all the structures behind it are perfectly fine. Perfectly fine. Okay, I should withdraw that now. Okay, doing alright there? Perfect. Right, same again here. I'm just going to gently insert that. Again, a very healthy ear canal. No bulging of the eardrum. No retraction of the eardrum. Visible structures, normal amount of earwax, so that's perfectly fine. Okay, let's take that as there. There we go. Okay, that's all good. Right, I'll just jot some notes down there. Alrighty. Okay. So I'm going to get a tongue depressor and I'm going to have a little look just in your throat if that's alright. Okay. Okay. Alright. Open nice and wide for me, my lovely. There we go. I'm just going to depress the tongue and I'm just going to come in with my light and just have a look down there. Okay. Say R for me. Okay, just relax, that's fine. And while I've got my light, I'll just have a little look at your eyes. Just look straight ahead there for me. I'm just going to bring the light in from each side and check your pupillary reaction. Okay, just look there. Perfect. And again. Okay, that's fine. Okay, that's all good. Okay. Right, let me just get my stethoscope on here. Okay. Just going to have a little listen to your chest, alright? Just move that there a minute. Just going to pop the stethoscope on. I'm going to ask you to breathe in and out for me. Big, deep breaths in and out, okay? I'll do it with you for the first couple of times, alright? Here we go then. So in and out. That's good. And again, in and out. Okay. Again. Okay. Again. Again. And again. Okay, just round the back a little here. In and out. Okay. In and out. Okay. Just breathe normally for me now. Okay, I'm just going to pop this on your neck. Okay, that's fine. I'll have a little listen to your abdomen as well. Just move that there. Okay. You've had no abdominal pains or anything like that. Digestion seems fine. Okay. Right, just going to have a little listen to your bowel sounds. That's okay. All good. Okay. So while I've got my stethoscope, I'm going to take your blood pressure. All right. So, just going to be putting this cuff around your arm. Okay. There we go. Let's outstretch that arm. Lovely. Put that on there. And put my stethoscope onto the brachial artery there. Perfect. And I'm just going to inflate with this, okay? Perfect. Okay, here we go. It's going to go tight, I'm afraid, just for a short time. That's perfectly fine. It's 122 over 82. I'm happy with that. So let's just remove that. There we go. Perfect. I'll put that there. I can remove that now. Okay. So, make a couple of notes there. So have you noticed any weight changes at all? Okay, that's perfect. Right, so make a little note of that. Right. There's a few more things that are on the checklist for me to check. I will be taking some blood from you if that's okay. Yeah? Right, I'm just doing a couple of other little checks, so just bear with me a second. I'll just go and get the syringe ready to take some blood, alright? 1 minute. Right, got that. Okay, I'll put that there for a second. Right, so I'm just going to have a little palpate of your abdomen, okay? Just check that before I do anything else. Just going to be pushing in, okay? If anything's uncomfortable, please tell me. A little bit deeper this time. Okay, I'm just going to just be tapping on the abdomen, okay? Okay, that's all good. Okay, I'm just going to take a little look at the skin on your arms, make sure everything's healthy there. Okay. You don't notice any problems with your skin? No, just a little bit of acne, okay. Yeah, your arms and your hands seem fine. Well, this side's fine anyway. Okay. Let's look at this side. Just relax. That's all perfectly fine, my lovely. Okay. So before I take the blood, I'm just going to do a little neurological check. Okay, they haven't asked me to go in depth. It's more about your sense of sharp or dull sensations. Okay, all right. So I've got this wheel here. Don't be alarmed, it's not painful. And I want you to close your eyes, okay? And I want you to tell me if you can feel something sharp. Okay, I'll just run that on your arm. Okay, yeah, or dull, which is just going to be my finger gently brushing down your skin like that, okay? Alright? Okay, so close your eyes for me. I'm going to start with your face now, okay? Tell me if it's sharp or dull, okay? Okay, sharp or dull? Okay, sharp or dull? Sharp or dull? Okay, and on your arms, sharp or dull? Okay, sharp or dull? Okay, sharp or dull? Sharp or dull? Okay, on your right arm, sharp or dull? Okay, sharp or dull? Sharp or dull? Okay, sharp or dull? Perfect. Keep your eyes closed for me. Okay, I'm going to run the wheel across your forehead. Could you just tell me if it feels the same all the way across, okay? Yeah? Perfect. Open your eyes now, my lovely, that's fine. Doesn't seem to be any problems there at all. Okay. So do you have any questions you want to ask me? Anything that has concerned you about your health at all? Okay, that's fine. Okay, I'm going to give you a sample bottle to take away with you. Alright, so I've got one of those here. Okay, so if you can just do a urine sample in this and drop it off at the reception desk after you've seen me. If you can't do it now, just drop it in later today if you can, and we'll get that checked, alright? Okay, so you can take that. There you go. Right then, I'm just going to do a little blood draw. I'm just going to be checking some basic bloods, okay? So it's going to be a full blood count. Alright, so that just checks how your blood composition is doing, your immune system, are there any signs of infection, inflammation, okay, and I also like to run the liver and kidney function test as well, and also thyroid as well. And I don't think for a minute you've got a problem with any of those, but it's just so we get a nice picture, okay, yeah. And the pathology lab will give us the results usually in about 24 hours, alright? Okay then, so I need to get a wipe here. Okay, any side of preference? Like your right side? Okay, so let's give that a wipe down there then. Lovely, okay. So I'm just going to pop this tourniquet around your arm. Make a fist for me, my lovely. Thank you. I'll just pop that on there. Okay. And got the syringe ready there. Right, okay. So you're going to feel a sharp scratch. Alright, so I'm just going to feel for the vein there. Usually have a phlebotomist do this for me, but they're fully booked, so I thought I might as well do it myself. You've got excellent veins. I haven't, mine are so bad. That's lovely. Right, okay. Just little sharp scratch as I do this, my lovely, okay. There we go. Perfect. Just need to change the bottle there. This is perfect. just one more little bottle there. Just bear with me, I'll just change that. Okay. Okay, that's lovely. Let's take that off. That's one okay off. Perfect. And if you could just hold this cotton ball on there for me, press nice and hard, that's wonderful. Okay. So let's get that in there, and that can go over to the lab. Wonderful. Okay. Okay. Let's just check that. Alright, I'll just pop you a little plaster on that, alright? Just to keep it nice and clean, but you've stopped bleeding. I don't think there'll be any bruising at all, so that's good. You were nice and easy to get blood from. Okay, let's just pop that on there. Perfect. Okay. Okay, so I'll send the report back to your employer. Everything is checked out fine. Like I say, it's only going to be the bloods and the urine test that we need to get the results from. But as far as the checks that they wanted me to do, you're absolutely fine. So there's no problem there at all. And they could always send you back to me if you were having any occupational health problems, of course. Okay then, so you go away with that urine sample bottle and I'll get the results over to your employer and they will relay the results back to you as well as soon as we've got everything together. Okay then? Perfect. Take care and enjoy the rest of your day.